I'm a physical therapist assistant here at McKenzie-Willamette. I also work in an outpatient clinic in Cottage Grove. So I see a lot of knees, I see a lot of hips, okay? My main job here is to interact with people that are having a joint replacement, and that's you guys. One of the things, the main goal of this class is to give you as much information as possible before your surgery so that this thing just goes really smoothly. We'll talk about a lot of different things in this class, but primarily we're going to talk about how to prepare for surgery, what to expect after surgery, including the day of surgery, directly after surgery, how to manage your pain, and discharge planning. So these are all the topics that we'll cover pretty thoroughly here. This class does take about exactly 1 hour, okay? So questions are encouraged. If you have a question, I want you to walk away knowing either the answer or where you can look for it. So before surgery, I notice most of you have a guidebook here. That's great. If you don't, let me know. I have some extras. I like the guidebooks for a couple of different reasons. There is a lot of information, just general information for you in these guidebooks. You want to be familiar with it. You don't have to memorize it. It does seem like it's a lot of information. I had some feedback from the same patient. When she took this class, she said she was overwhelmed by the amount of information in the book. After her surgery, she said, oh, I had a question, and guess where I found it? In the book. So the other thing that I like about this book is that it's the fact that it's a notebook. You can stick your questions for your surgeon in there, that type of thing. So it kind of helps keep you organized. You do not have to bring this to the hospital with you when you have surgery. If you want to, you can, but you don't have to do that. Okay? We'll give you plenty of information while you're here. So the other thing that we want to make sure that you do, if you have a metal allergy, this is a new line that we're putting in here. If you have a metal allergy, please let your doctor know, okay? So if you've worn some bracelets or earrings or necklaces that weren't really high quality metal and you had a reaction to them, please talk to your surgeon about that. Planning ahead is the whole theme of this entire class. We want you to know that when you leave the hospital, we recommend that you have somebody with you for 7 to 10 days for 24 hours. Okay? That doesn't mean that they have to stand over you and watch your every move, but we do want that person's primary role to be taking care of you. So if your spouse works full-time, and they can't get some time off, maybe that's not the best idea. So really start thinking in terms of how you're going to have somebody help you out for 7 to 10 days. All right? If you're by yourself, sometimes looking at the possibility of a rehab center is a great idea because then you're there, you're taken care of, you don't have to worry about that. All right? We want you to identify somebody who's going to be your coach while you're here in the hospital as well. It's a busy time in the hospital. It's a really busy time. You're really going to be active doing a lot of different things, and the coach can be that person that can really help keep you focused. The coach also tends to be the person who asks that question that you didn't think about. For example, I've been married for 33 years. Every time my husband and I go do something, he always asks a different question than I do. It's a good question. It's just not something I would have thought of. So having that person around can really be helpful in this. So before surgery, whoops, no, this isn't moving for me. Okay, so the role of your coach, just like I said, is to help you keep focused on your healing while you're here, asking any questions that you might not have thought of. And we really like that coach to attend the exercise classes if possible, but definitely attend the discharge class. That happens on post-op day 1. So the day after your surgery at about 10:30 in the morning, we have a discharge class. And that's a perfect place for your coach to be. It's a lot of information. It's put together by the nursing staff, so they talk about blood clot prevention, infection controls, all of those different types of things. It's quite a bit of information, so that's a great place for your coach to be. If that doesn't work out, that's okay. We prefer that they were there, but you definitely get a packet, and your nursing staff will go over all of those things for you as well, just to make sure you understand. So we find that having somebody involved really just makes it a better experience for you. Before you have surgery, we want you to look at your house and see if there's throw rugs around. Take a look at the space. A friend of mine had a knee replacement, and for some reason the space between his couch and his hallway was too narrow. I don't know what he was doing beforehand, but we had to move his furniture a little bit for him, just so that that's convenient. You just want to be able to walk through your house safely without having to move any furniture or move around anything in any different way. So take a look at that. If you have animals, make sure you have a plan for them. They will be a tripping hazard for you when you get home, all right? So make sure that you have an idea of somebody going to hold on to them for you for a few days, or if they're going to be in another room or what have you. And then also think about meals. How are you going to get food? Who's going to prepare that? If you're the cook, maybe you have to do that in advance, or whatever. Just come up with a plan for that. While you're here, we feed you pretty frequently. So 3 meals and some snacks. So I can't guarantee how great it is, but there's a lot of it, okay? When you pack up for the hospital, we want you to bring your CPAP machine if you use one, or any other type of medical device that you use on a regular basis. CPAP is the one that comes to mind. That's the breathing machine at night. Please bring that with you. If there's anything else that you use on a regular basis, medical equipment-wise, please bring that with you. You're going to bring your incentive spirometer. It's a clear box with the blue hose on it. You'll get that when you talk to you do your pre-anesthesia appointment. They'll show you how to use it. We want you to practice using that prior to surgery, prior to coming into the hospital. If you get here and you don't have it, I'll find you one, okay? It's that important. It's a way that you exercise your lungs while you're here with us. So it's important to do beforehand and afterwards as well. Okay, so when you pack up for the hospital, you got your CPAP, your incentive spirometer. You're going to bring loose fitting clothing. You're going to 2 exercise classes a day. Think in terms of 2 exercise classes a day. If you're having a knee replaced, we want to be able to roll your pant leg up so that we can see your knee. If you're having a hip replaced, just remember something loose and comfortable around. Bring a couple of shirts so that if you spill lunch on your shirt, you feel like you've got a clean shirt to wear. Comfortable, supportive shoes. I wear an orthotic in my shoe. I do not walk without my shoes on. So if that's you, you want to bring your shoes and your orthotics. Also, we have the sticky socks. If you would rather just use those, that tends to be what most people just use, the sticky socks. So shoes are an option for you. So we want you to leave behind valuables and medications. Please do not bring a bunch of computer stuff here. Your rooms are not secure. You will be out of your room for the 2 exercise classes and for walking a day. If you have a roommate, they frequently are in the same boat as you, so they're out of the room as well, okay? You certainly can bring a cell phone if you need to. I wouldn't be able to contact my family without mine, but keep in mind your room is not secure. You do not want to leave your belongings out while you're out of the room. The other thing you want to make sure you don't do is stick them under your sheets or your pillows thinking that they're hidden. They are hidden, but they might end up in the laundry as well, okay? We have a cupboard and there's a tray for you to kind of stash things in. The same goes true for people coming to visit. You want to make sure you don't just leave your handbag or your laptop or whatever in the room. You want to kind of keep it secure, all right? Help remind us. Sometimes we forget if you have that type of stuff. You want to make sure to let us know, and we'll help you tuck it away as well. You do not bring your medications. You bring your medication list, and the hospital dispenses your medications to you. All right, so when you check in, they're going to verify your medication list. They're going to want your photo ID, your insurance card, and be prepared to pay for any copay that you might be responsible for. If you're not sure what your copay is, talk to your insurance company, because that's who's going to determine that. So the night before surgery, you don't want to have any solid foods or dairy products after midnight. Okay? Clear liquids are okay up to 3 hours before surgery. So if you've talked to your pre-anesthesia nurse and they've said, we want you to take your medications before surgery, blood pressure medications, what have you. That's where the clear liquids are going to come in handy, all right? We don't want you to be drinking gallons and gallons of Gatorade or juice, or we don't want you to drink a lot of clear liquids. Sips of clears 3 hours before surgery are completely fine. No dairy products, and including the coffee creamers. So if you're having coffee, don't add even the powdered coffee creamer to that, okay? So the night before, when you go to your pre-anesthesia appointment, you're going to get that incentive spirometer. You're also going to get 2 silver packets that look like bars with soap. They'll give you instructions on how to shower, which sounds kind of silly, but we want you to do a certain way. So the night before, you're going to have clean sheets on the bed, a clean set of clothes, a clean set of towels. You'll take your shower, you'll use your scrub like they instruct, and you'll throw that one away. The next morning, another set of clothes, another set of towels, another shower, use the second scrub, throw it away, and then you'll come on in, okay? Don't worry about your hair. Please don't use a lot of hair products. We'll let you fix your hair afterwards, okay? We will. You'll have time to do that. Don't worry about that, okay? So the day of surgery, we're going to talk about those medications again. You'll take only the medications that your anesthesiologist said to take. You'll talk to them about that in the pre-anesthesia appointment. Make sure you tell them everything that you're taking, even herbal medications, over-the-counter vitamins, those type of things, any of those things. You want to arrive at the hospital 2 hours before surgery. One surgeon's office note is saying 2.5 hours. That would be fine too, okay? No less than 2 hours before surgery, and you check in at the emergency room. So this, once you get checked in the emergency room, they're going to give you an ID bracelet. They've taken your insurance information. They've verified your medication. You're going to go up in the elevator to the 2nd floor. That's really right now the only place that we have a pretty good size waiting room. Your family can definitely go with you to the surgery prep area and to the waiting area. We're going to ask that a family member is around after your surgery to talk to the surgeon. We'll talk about time frames on that as well. Then you'll go to surgery, which is also on the 2nd floor. You'll spend time in our PACU, the post-anesthesia care unit, and then you'll head up to the 3rd floor. All right, that's where you're going to have your room. We want the family members in the surgery waiting area after surgery. Typically, surgery takes 1 to 2 hours, typically. Your surgeon is going to give you a good idea before you go in. If they think they're going to do something a little lengthier or shorter, they're going to give you a good idea for that. On the 2nd floor in the waiting area, there's staff members, there's volunteers. If you need to leave your family for a little while and go get some food or what have you, let them know so that they can kind of help coordinate that, all right? What we don't want to have you do is take your assistive devices to the 2nd floor, like your canes and things like that. They do not have room for it. They just don't have room for it. We'll talk about when you can bring those in, but don't take those to the 2nd floor. So your time in recovery in the PACU is about 1 to 3 hours. It depends. Everybody's a little bit different. So they're going to, check your vitals, help you manage your pain, all those type of things, make sure you're good and stable. You'll go from PACU to the surgical care unit 1 to 3 days. Typical time in the hospital after surgery is 1 to 3 days. What I'm seeing more and more frequently is people are leaving post-op day 2. So we look at it this way: surgery day is day 0, post-op day 1, day 2, etc. It is most frequent that people are leaving post-op day 2. I see oftentimes people leaving the day after surgery as well. It depends on a lot of factors, but I make this point because your time here is really short. It's a really quick process. So being prepared for this process in advance really makes a huge difference. All right. So on the 3rd floor, that's where your physical therapy starts. We're going to talk in a minute specifically how that day is going to look for you, but it's pretty busy. It's a pretty busy day. So the 3rd floor, we actually have this football field up there. It's a way for you to track where, how far you've walked. The staff up there is trained to manage pain. trained to help you stay on your routine after your surgery, and trained in making sure that you're getting everything that you need after your joint replacement, okay? We tend to keep you in one spot in the hall because it's just easier, and it's kind of nice for everybody to be down in one spot of the hall. We have a training room down in the corner where we end up doing all of your exercise classes as well, okay? So some of the changes that have been made to the surgical processes themselves and to the rehab process has made people feel really good really quick. And that's great because we're able to normalize your mobility as quickly as possible. Long term, that's a good scenario for you. What we're finding is some of the pain management tools that we're using are making people feel maybe a little too good. And they're getting up and they're doing things independently before we're really ready for them to do that. So what we ask is that while you're here is that you use our call light system. Just push that big red button when you need to be on your feet. So if you're needing to get from the bed to the chair to the bathroom, etc., just ask for our help. At the very least, we'll blaze you a trail. We'll make sure everything's out of your way. But we really want you to be safe while you're here. The other thing that happens, that if you haven't had surgeries before, you may not realize, after a surgery, blood pressures really can change pretty quickly. And so we certainly don't want you to get in a spot where you're halfway across the room and then you start to feel faint and pass out, that type of stuff. So we really want to help you be safe. So use our call light system, all right? We don't want you to fall while you're here. We don't want you to fall at all, but particularly not while you're here. So pain management is something that I think is a team effort. We do a handful of things. One of the things that studies have shown is if somebody uses a standard measuring stick tool of some sort to assess their pain on a consistent basis, they actually end up taking pain medications for a shorter period of time after surgery. So the tools that we use here are the rating scales. I tend to use the 0 to 10 scale, this one here. 0 being nothing, 10 meaning you're in a puddle, okay? In the PACU, the recovery room, they might use the faces and just have you point at one of those. It really depends on the practitioner. But what we know is that people who are having joints replaced, it's already painful. You've lived with pain for probably quite some time. So for you to have post-surgical pain, you're thinking, well, this is normal, this is fine, I'm always in pain. And that, in a sense, is true. But what we know about surgical pain is it tends to rise unless you address it as it starts to go up. So using this scale, you'll have a good idea of the direction it's going. Is the pain going up? How far is it going up? What do I need to do about it? We've found that when we react, as soon as the pain starts to go up, we're able to keep that pain better managed and with fewer medications, with less interventions. So I don't want you to be obsessed about your pain, but I really want you to think about now, how do I measure this? What is it? Is it a 0? Is it a 2? That type of thing, and really get in practice of using that tool. The other thing is back to the fact that you'll be here 1 to 3 days. We're going to be asking you this, where's your pain, where's your pain, where's your pain, what's your pain number? But you're going to be out of here pretty quickly. Who's going to ask you that at home? So you really need to, using this tool when you get home is a really helpful thing as well. So we know that acting when the pain starts to go up is really beneficial, really gets it under control quickly. And there's a lot of different things you can do to manage the pain. We recommend that you take your pain medications 30 to 45 minutes before activity. In the hospital, the nursing staff knows when we're coming. So they're going to have you pretty much on schedule for that. When you get home, you're going to need to take that prior to your outpatient physical therapy, all right, or prior to you getting up and going to the store, those type of things. So again, using that pain scale is a really good way for you to manage that. So some of the other things that we do for pain management are icing, elevating, and moving. So a lot of times when you're really hurting, the thought of moving does not sound logical to you at all. But once you start moving a little bit, things loosen up and it really does help. You'll probably notice that after sitting here for an hour, you're going to get up and move your leg around a little bit and then it'll feel a little bit better. Same concept. Cold therapy, if you're having a knee replacement, you're going to have a polar pack coming on you when you come out of surgery, and that's yours to take home. If you're having a hip replacement, you get a great old-fashioned ice bag, and we just put it right on that. It doesn't matter how you ice, but icing is important. It helps to decrease pain. It also helps to decrease swelling. So the medications that are typically prescribed to patients are narcotics, muscle relaxants, and anti-inflammatories. They tend to prescribe them in a group, all right? If you have questions specifically about you and medications or what the surgeon's actually going to prescribe for you, if you've had any problems, allergic reactions, any of that type of thing to medications, talk to your surgeon. Have that conversation with them. Let them know what the problems have been so that they can make adjustments, okay? While you're here, if you're having any reactions, sometimes the pain medications can make you a little nauseous or they're not impactful or any of those kind of things making you too lightheaded or dizzy, talk to the nursing staff because they can communicate with the doctor and see if we can make some changes, okay? So when you leave, we do not dispense individual pain pills, but you do get a prescription. So when you leave the hospital or before you leave the hospital, particularly for you guys being out of town, we would give you the prescription so that you could go get it filled locally and then have it before you get home. We do recommend that you don't let the sun set on your discharge day without your pain medications, okay? We want to make sure you have those to get through the night. Locally, we have Walmart, Walgreens, Rite Aid, Bi-Mart, Safeway. Pretty much every pharmacy that you could possibly use is really close by, okay? So physical therapy, so this is my personal bias, it's what I do, and it's also what I have seen to be really impactful for people after a joint replacement. So just so you guys know, physical therapy after this joint replacement is part of the whole package. Okay, it's part of what's going to make the new joint mobile, strong, all those kind of things. So there's some exercises in your book on page 17. I don't have all of them up here. If you did these exercises and took your sweet time, they would take maybe 20 minutes. But we recommend that you start doing these exercises beforehand. They're really not complicated. Ankle pumps, quad sets, so squeezing your thighs, squeezing your backside muscles, some arm push-ups because you're going to be using the arms a little bit more than normal, and straight leg raise. There's more in the book, but again, if you take your time, 20 minutes, all right? So it's not that big of a commitment. The other thing I want to talk about with exercise is if you are currently in a swimming program or you're doing a certain exercise right now that your surgeon hasn't said, for goodness sake, stop doing that, I don't want you to stop exercising before surgery. Keep doing it until the day before surgery, all right? The stronger you are, the better things are going to be for you. So if you have an exercise program that you're using right now, use it. After surgery, things are going to be different, all right? So go ahead and keep exercising. We're going to teach you exercises in the exercise classes that are appropriate for you until your outpatient PT tells you otherwise. And we'll give you a routine on how frequently to do them and all that type of stuff. You'll have them in writing, you've had practice them, and there won't be any question at all. Okay? So in the hospital, you've had surgery, you've gone through PACU, gone through the recovery room, now you're in your room on the 3rd floor. If you get to your room on the 3rd floor before 3 o'clock in the afternoon, a physical therapist is going to come to your room, they're going to do a full assessment, and they're going to take you for a walk. Your surgeon's goal is that you're walking the day of surgery. That's their goal. Doesn't sound like fun, but that's their goal. If you're on the floor after 3 o'clock, PT staff will see you in the morning. They'll do the same thing, a full assessment, and take you for the walk first thing in the morning. But after 3 o'clock, nursing staff is going to come in. They're going to do an assessment as well, see how well you're feeling your feet and your legs, see if you're dizzy, nauseated, any of those things, and get you up, take you to the bathroom, and see if you're appropriate to be sitting up in a chair for a while. Most of you are going to want to do that. You've been laying down for a while, so most of you are going to want to get up and do that. So we get you moving as soon after surgery as possible. Okay, so the next day, if you haven't been evaluated by a PT, one will come in and do that full assessment, all that type of stuff, and take you for a walk. If you already were evaluated, you're going to have individual treatment. That's going to include gait training so that we can optimize your gait, not just to get you around 350 feet as quick as possible, optimize your gait pattern, bed mobility, how well are you getting in and out of bed, stair training, any of those things that you need to do at home. Typically, those are the 3 that we focus on. If you have something in your home that you are concerned about right now, how do I do this? That's a great time to talk to us about that, and we can help you strategize with that, right? Group therapy is twice a day. We come and get you there. Don't worry about that. First class is at 9:45. Second class is 2-ish. Post-op day 1, you're going to have that discharge class right after the first exercise class at 10:30. It's a busy day. You get 2 individual treatments a day, 2 group exercise classes a day. So I have a couple people having hip replacements. Things that we need to talk about. The first 3 months after a hip replacement are the most risk for dislocation. It doesn't happen frequently, but it does happen. While you're here, we're going to talk to you about specific things that you should and should not do after we've seen your operation report. So we know exactly how the surgeon put it in, exactly what any specifications they have. So hip precautions, we teach them to you. Do not worry about them. We give you the opportunity to practice them. You have them in writing. We give you exercises to help you with that. Also, you'll have an OT come in and help you with a lot of different things too, to make sure that you're getting in and out of bed, in and out of the bathroom, getting your clothing on, getting your shoes on, all of those things, and being compliant with your hip precautions. So before your surgery, we don't really know exactly what your hip precautions are going to be because your surgery is going to be individual. So 2 hip precautions, general, these are for life, are these 2. So you cannot externally rotate your leg, I don't know if you can see this, and take a big step back, so you can't do that. That's for life. The other thing you can't do is bring your knee up and turn it in. That's for life too. Everybody laughs at this one, but this is the most common one because this is how a lot of people put their shoes on, right? So what we're going to coach you to do is turn your knees out and get your hands on the inside to put your shoes on. So those are universal precautions that we teach to everyone. Don't worry about it. You have plenty of time to practice it in the hospital. We'll make sure you understand it before you leave. So depending on the surgical approach, 6 to 12 weeks, you're going to have other precautions. And your surgeon will talk to you about those if anything's different, and so will we. All right? So equipment. Typically what I see people have the most success with right after surgery is a front wheel walker, like that one right there. Okay? That's typically what I see people have the most success with. Here's why. You can put a little body weight in your hands. You don't have to pick it up. You can just roll along and have some support and some balance and really optimize your gait pattern. That's one of the primary functions of an assistive device, is to optimize your gait pattern. We do want you to be safe as well, but we want to get that so you're walking nice and normal. You don't have anything weird going on while you're walking. And that's one of the main things that we use an assistive device for. While you're here, we have walkers that you can certainly use. you're going to need to get a walker. Some people do well with crutches. I'll talk about crutches for a moment. Some people do well with crutches, and frequently people go to crutches a couple of weeks after their discharge. The thing about crutches is they take a little bit more energy to use and a little bit more coordination. And the day of or the day after surgery might not be the most optimum time for you to challenge your coordination, okay? So we'll help you determine that. We definitely do crutch training for everybody while they're here, whether it's describing how to use it or actually having them practice with them. Typically, the front wheel walker people feel the best with. Any of the assistive devices that you need, you can get almost anywhere. So retail stores, Walgreens, Bi-Mart, Walmart, Rite Aid, any of the pharmacy stores, they do sell front wheel walkers. They're approximately $100 brand new, approximately. You can get them from medical supply places like Shaw Medical, Gateway Medical. There's others as well. Their prices vary. The benefit of going to a medical supply place is some of them will bill your insurance for you. Some of them won't. So it would be worth a phone call to find out if they will or if they won't. A really easy way to get one, particularly if you've got some time before surgery, is to go to St. Vincent de Paul, go to Goodwill, there's a hospice store on Main Street here in town. There's a lot of places you can go and get them used. They're pretty simple to size. You stand up nice and tall inside the walker, let your hands hang down, and this part of your hand should touch the gray handle. Pretty simple to size. If you are getting a used one, please get one with wheels that are about this big, all right? So probably 3 inches in diameter. I've seen some 1-inch diameter wheels, and they're just not as stable. So take a look at that. And I think I've seen the same one around a couple of times, maybe got donated back to the Goodwill again. So the bigger wheels are better, all right? Crutches the same way. Most insurances will not pay for crutches. Some do, most of them do not. So if that's where you're headed, that's going to be something that you're going to need to obtain. You can also find walkers if you live in a 55 or older community. Somebody's got one. Some service organizations loan them out. Some churches, those type of things. So start poking around and see. If you are going to get one used in particular and you want us to take a look at it for you, don't take it on day of surgery to the second floor, but have it in your family member's trunk and they can bring it up the next day. We can take a look at it for you. Okay. So for hips and bilateral knees, we do have an occupational therapist who comes in and we do a lot of this as well, showing you how do I get dressed? How do I get on and off the couch? How do I get on and off the toilet? Those are important questions. So for occupational therapy, it addresses appropriate positioning while you're doing these things. So it helps you comply with those hip precautions, you know, while you're getting your shoes on. It's important. So thinking about your household space, thinking about your bathroom, your bathtub, your shower, all of those things, right now is a really good idea. So here's some equipment. Most insurance does not cover other adaptive equipment, so we'll just kind of go with that. The first one is a toilet seat riser. This one here. So this toilet seat riser, obviously it does exactly what I say. It makes the toilet higher. But what I don't like about this particular kind is it's on with suction cups. So every time you move, those suction cups kind of move. If you are not having any trouble getting on and off your toilet right now, you likely are not going to need that, okay? If you are having trouble getting on and off your toilet, what I would do is find a bedside commode, either at a medical supply place or, you know, Goodwill, that type of thing. The bedside commode has armrests. You take the bucket out, raise the legs up and put it over your existing commode. Now you have handles and it's higher, okay? A lot of times what people need is just a little handle to push up with. That front wheel walker that you have, you can use that way. So you walk it up to the back of the tank, turn around. Now you've got handles to sit down and to stand up, okay? The one thing that I want you to think about really hard is a shower chair, okay? Showering takes the most energy for you to do, What we know is you have one good leg to stand on. And you're wet and you're slippery. So if you can sit down on a shower chair and take your shower, have that handheld shower head, you're going to be able to relax, take a shower, and your family member is not going to be too worried about you. Okay? So thinking in terms of a shower chair is a great idea. The problem with shower chairs is you really have to consider what your tub situation is like. Okay? Because this one spans the tub, the legs adjust just like, walker, so the ones on one side are longer. Sometimes you can find like a shower bench that fits into like a stall shower, that type of thing. So take a look at your shower space. Go take a look around. Most medical supply places have a big variety of them. Find out what works for you and then see if you can't find it used. So hip replacements. This is called a hip kit, and I really like it for a lot of reasons. It helps you get your clothes on, helps you get your shoes and socks on, helps you get your pants on, also helps you get them off, okay? So let me just kind of go over what these are. These are elastic shoelaces, so any shoes are now slip-ons. You don't have to worry about bringing your foot up and tying it. This is a tube, a half a tube. You put the sock all the way on the tube, put the tube on the floor, pull it up your leg, and now your sock is on. It's pretty cool. Works for your TED hose as well. This is a grabber. My favorite thing, a gentleman who was like 6'2" said, why would I need a grabber? I can reach everything except for your pants that are on the floor here. So the grabber, you put your pants on the floor, put your feet in, and then you can pull the pant legs up. You can also use it to hold your shoe in place while you get your shoe on. So this is a dressing stick, used more for shoulders, but that's going to come in the hip kit as well. And this is a long-handled shoe horn so that you can actually get that shoe on without bending far over. And this is a long-handled scrubber so that you can wash your feet, that type of thing, and comply with your hip precautions. So I know a lot of people say, oh, you can get this at the dollar store and that at Walmart, et cetera, et cetera. I've seen this exact hip kit on Amazon for about $30. So it's not terribly, terribly expensive. You can certainly look around and find each individual item, but if you take into consideration gas and wear and tear, it might be easier just to find it in one place and buy it. All right, so outpatient physical therapy. So everyone having a joint replaced is needing outpatient physical therapy. Typically, it's about 6 to 8 weeks after your surgery that you're going to be participating in therapy. If you're having a knee replaced, we want you to be seen by an outpatient physical therapist no later than 7 days after your surgery date, not your discharge date, your surgery date. Okay? So for a knee replacement, no more than 7 days after surgery date. You need an appointment to go see an outpatient therapist. For hip replacements, it's 2 weeks after your surgery date. So the reason I emphasize this is that you're going to be in the hospital for a very short period of time. You're going to need to be in a therapist's office pretty darn quickly after that. And therapists can sometimes be like dentists. We fill up pretty quickly. So if you don't have an appointment with an outpatient therapist at this time, you definitely need to get one. All right? So what happens if your discharge date changes a little bit or something else comes up? If you're on their schedule, they can more easily move you around than to put somebody brand new on the schedule. If you call an outpatient therapist office and they say we need an order from the doctor, hang up, call your doctor's office and say, here's the outpatient therapist I want to go to. Can you send them my order? And they'll fax it over. You call them back and make that appointment. It's really simple. If you're going to a rehab center, typical time frame in a rehab center is about 2 to 3 weeks. So you know you need treatment for 6 to 8 weeks. So I would go ahead and get on a therapist's schedule anyway so that you know where you're going to go from there. So here's the thing about an outpatient therapist. You can go to whoever you want to go to. Whoever you want to go to. There are some samples in the book, although they are completely incomplete. They left off the Cottage Grove ones. So I have some samples that says guidebook for knees, but therapists are therapists, of some other therapists. There's a couple on this list that are not on the list in your book. They're organized by region. You can go to whoever you want to go to. If you haven't already have a relationship with an outpatient therapist that you've been doing prehab with, that's a fantastic place to start. If you know of somebody who's been to a therapist and they had a good experience, that's also a good place to start. Keep in mind, you'll likely be there twice a week for about 6 to 8 weeks. So don't make it a 2-hour drive. Make it somewhat convenient to get to, okay? What does not happen anymore, this question comes up every week, we tend not to do home health physical therapy. And the reason for that is home health physical therapy is 1 hour a week. We know we want to see you more frequently than that. We want to be more aggressive with your therapy than that. So another person you're going to see while you're here is a case manager. You'll recognize them. They wear street clothes. They're very fast in and out of your room. They're very fast. What they do, though, is all the behind-the-scenes stuff with your insurance company and rehab centers. And doesn't look like a lot of fun to me. I'd rather deal with people. So if you're going to a rehab center, they are going to be the ones that actually make the arrangements to have that happen. So they make sure that it's all set up with your insurance company. They find you a place. They arrange a ride. The place comes and gets you. You go there, get into your room, and start from there. So the other thing I'd like to bring up at this point is if you are planning on having a variety of people take care of you while you're at home for that 7 to 10 days, or think in terms, put it in the back of your head. If nobody is going to be in your home for 7 to 10 days, you're going to need some help. So stick that in the back of your head, that rehab is a really good option for that 7 to 10 days if you've got nobody at home. So if things dramatically change, and I see it all the time, somebody's mom got sick, they had to leave town, things happen. So keep that in the back of your head so that it's not a complete surprise if something dramatically changes at home, because we really are not keen on letting people go home by themselves. So discharge. We know what happens 1 to 3 days after surgery. 2 days is what I typically see. Someone put on here between 11 and 2. That's not how it works at all. What happens while you're here is the surgeon or his assistant is going to come in the morning and talk to you, and then surgeon or assistant is going to come in the afternoon and talk to you. You're going to see the doc a couple times a day, or somebody from his office. Typically what happens, and the doctors have communicated with us, they see all of our PT notes, they see all the nursing notes, they know exactly what you're doing. They know exactly how you're doing, they know all that stuff. So the surgeon is going to come in one morning and say, hey, are you ready to go home? And you're going to say yes, right? Because you want to go home. Don't worry about jumping up and getting dressed and getting your stuff. Just relax. Typically what has to happen after that, the surgeon has to actually finish his rounds. Okay, so the other patients, they have to write the actual discharge order, which doesn't take terribly long, but they might not do it right away, like right after they leave your room. And they often request that you are discharged after your second PT session, which is 2-ish. So it's going to be in the afternoon. So don't worry about that. Nursing staff is the one who actually is filling out all the paperwork and putting everything together. Obviously, we know this is a quick thing, so we have as much of that filled out beforehand as possible, but there are some details that have to be taken care of at the last minute. Nursing staff is going to be the person to talk to as far as a time frame goes, okay? Now, for you guys, you live farther away. If you need to leave earlier or, have any of those kind of things, start having that conversation with us early, so that we can see what we can do to make that happen, okay? If you're going to rehab, what happens is the case manager comes in and says your ride will be here at 3. And you just hang out, we help you pack your stuff up, ride comes up, and then off you go. All right. So while you're here, I hope you're getting this, that we really want you to be an active participant. Ask as many questions as you can. Make sure that when you and your family leave that you know exactly what you need to do and how you need to do it. or if you don't know, you know how to get that information. We want you moving around. We want you walking. The one thing that's difficult is that we say, hey, don't do this by yourselves. We kind of loosen those leashes as you show us that you're not going to pass out in the middle of the hall, that kind of thing. So that usually we'll keep communicating with you on that. We want you to have making sure that you're communicating your comfort level to the staff. If you're taking a pain medication and it is not addressing your pain, that is not what we want to send home with you. Right? We want to make sure that we get something that works well for you. So making sure that you're letting us know anything that's going on and asking a lot of questions. Any of your discharge concerns, like I say, every once in a while it happens where somebody's best laid plans just kind of, disintegrated while they were here in a day or so. That happens. Making sure you're discussing any of those concerns with us here, all right, so that we can help you address those. And just making sure that all your needs are met. Let us know, okay? The one question I couldn't answer is why the food wasn't what they wanted. All right, so we know that doing your exercises regularly, consistency has more impact than intensity in this case. Icing and elevating, managing the pain and managing the swelling. Taking your pain medication is needed. So now you have that ruler that says, where's my pain? I know where it's going. I know how to address it. Taking your pain medication when you need to do so, but lessening the frequency of that as you can, okay? We want you to be able to fully participate in therapy. So that means we want your pain managed, but we also want you to have not so much fog, okay? And sometimes pain medications can do that to you. Walking short distances and increasing them by small increments. You're going to do that daily. When we walk you here, we typically walk you about 350 feet. That's the length of our loop. So what I don't want you to do is go home and go, oh, I'm going to walk 6 blocks. Small increments. So we know short, frequent bouts of activity actually are more impactful in you getting stronger more quickly. So adding 50 feet on, seeing how that went, all right? And then we also know that using your assistive device, your walker or your crutches, every time you're up helps prevent falls, but again, it normalizes how you walk, which is what our goal is, all right? We're going to talk to you a lot about that while you're here, normalizing your gait. Your outpatient therapist will also be talking to you about normalizing your gait. It prevents other problems up and down the chain, hip, back, shoulder problems, okay? And making sure that, you're just really taking care of yourself. All right. Thank you guys so much.